subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Devashish Desai, who's a leading infectious disease specialist. We've got him here today to speak to us about the new COVID scare and, well, should we all be scared about it, or is it just like just another threat that is perhaps being spoken about in the media more than it's a reality. A little about Dr. Desai. He completed his MBBS at the Kasturba Medical College in Manipal. He then completed his MD in General Medicine and DM in Infectious Diseases at the AIIMS in New Delhi. He was a member of the AIIMS Covid-19 task force and has treated hundreds of patients with severe COVID-19 in 2021. He currently practices as a consultant in infectious diseases at the Ruby Hall Clinic in Pune. Welcome to Health Live at Seniors today, Dr. Desai. How have you been?
I've been good. Thank you so much for having me. Good evening to everyone.
Dr. Desai, before you start, before I request you to speak to our readers here, the people who are watching you, tell me, is this a feeling of what was there in 2020, or are we making too much of it right now?
So my understanding is that there's definitely a fear psychosis looking at the news that is coming out of China. Considering that they are having hundreds of thousands of cases per day and their crematoriums are packed. But in all probability, this is going to turn out a little more like the way Omicron was, as opposed to the way it was in 2020 or in March of 2021 with the Delta variant. If you look at China, this is their true first wave. They've never really had a widespread outbreak, infecting a large part of the population before this, because they've had a zero COVID policy. So right from the start of the pandemic, even if there were a couple of cases that tested positive in a city, the whole city would be locked down, and everyone who tested positive would be quarantined, and the whole population would be mass tested again and again until the numbers would come to zero. So China has a large population that has never had a natural infection. So what they are going through right now is what we went through throughout 2020 and the first half of 2021. So most of us don't expect what is happening in China to happen here. Are we sure about this? No. COVID has proved experts like me wrong many times in the past. But our best guess is that we're going to have a lot of coughs and colds and the occasional severe disease, especially amongst those who are elderly and unvaccinated and with comorbidities, but nothing like what we saw in 2020 and the first half of 2021. I think those days are probably behind us.
Doctor, I'm a journalist, so I could not have not pounced on what you just said, and you put an experts under quotes. Is this, as we saw in COVID at that time, there were a host of experts and even doctors, even the medical fraternity didn't really know what's the reality and how severe the problem is. Is this what is happening right now? How much are all of you, and especially somebody like yourself who's an infectious disease specialist, how much are you on top of the entire problem that exists today? And perhaps if there is another wave, are you really on top of things? Is the medical fraternity on top of things? I'm sorry to ask you this question directly, but perhaps you could enlighten all of us over here.
So in terms of understanding the biology of the virus, I think we've come a long way. So when COVID first started in Wuhan, we were tracking it all the way from December 2019. In the beginning, we knew nothing about it. We had no understanding of why people got sick, what the course of the illness was. And gradually, as more and more data started coming in, we started to understand that you have a lot of people with asymptomatic infections. A lot of people who are symptomatic sort of get okay by themselves within a couple of days. But a small fraction of people, by the end of the first week of their symptoms, develop what is known as the cytokine storm, where their immune system sort of goes into an overdrive. And that's what causes a drop in oxygen saturation. And this is what basically kills most people. So our understanding of the biology of the disease has definitely sort of improved over the last 2 years, and consequently, what drugs we should use and when to treat patients with severe COVID. With regards to solutions to the pandemic, those are logistical. Do we have enough hospitals? Do we have enough ICU beds? Do we have the right drugs? Do we have the right protocols in place? Do we have enough equipment? So this was basically the main challenge for us in 2020 and the first half of 21. We are not anticipating that sort of situation right now. We don't expect a flood of patients with severe pneumonia to be coming to the hospitals. But let's say it were to happen, I think the country is much better prepared now in terms of infrastructure after having gone through it the hard way over the last 2 years. Today, that is.
Doctor, I'm going to request you to make your remarks on the topic first, and then we'll get on to questions. Those of you who have questions over here, please put them in the Q&A tab. If you have a specific question about yourself, please put in your name, put in your gender as well as your age, so that Dr. Desai could give a considered reply. But over to you, Doctor, for your opening remarks, and then we'll get on to the Q&A.
Okay. So as clinicians, when someone calls us and says that, I've tested positive for COVID, the main thing that we are concerned about is this a mild COVID or a moderate to severe disease, right? And the one parameter that differentiates mild from moderate to severe is the patient's oxygen saturation. So like we discussed earlier, most patients will have mild disease in the sense they may have symptoms, but their blood oxygen saturation will remain more than 94% throughout the course of the disease. A small fraction of patients at the end of the first week will have a slow drop in oxygen saturation. And once it falls below 94%, that is when we have transitioned from mild to moderate to severe. And that is when we as doctors press the alarm button. That is when a patient needs to be admitted. That's when a patient needs to be started on IV medication. That's when the patient is making the transition from the virological phase to the inflammatory phase. And most cases of COVID pneumonia in the hospital are basically those patients who have desaturated at the end of the first week. So the advice that we would give in the first year of the pandemic, and especially during the Delta variant, was keep a saturation probe at home. If you've tested positive, check your oxygen saturation once a day. As long as it is more than 94%, there's nothing further to be done. Just treat yourself symptomatically. By symptomatic treatment, what we mean is, drugs that basically make you feel better. They don't really alter the course of the illness. So if you have fever, you take a paracetamol. If you have cough, you take a cough syrup. All of this is just to make you feel better while you yourself sort of recover from the virus. The issue with people who are going into moderate to severe diseases, as their oxygen saturation starts dropping by the end of the first week, these patients don't necessarily feel short of breath like other diseases that cause a drop in oxygen saturation cause. So unless you're actually checking your oxygen saturation, you won't know whether you've made the transition on the basis of your symptoms. So what would happen in 2021 is people would have had a low resting oxygen saturation for a couple of days before they would come to the hospital. And at that point, the COVID pneumonia, or ARDS as we call it, has already set in. And starting treatment at this point doesn't always lead to a good outcome. So, the trick with these patients is to start treatment as soon as they make that transition from mild to moderate severe. So our standard advice would be, if you've tested positive, keep a saturation probe at home, check your saturation at least once a day. And if you find that it is gradually and consistently falling below 94% and refusing to rise more than 94%, that is when you need to get hospitalized immediately. However, when Omicron came around, November or December of last year, that advice stopped holding much validity because very few people would get sick. There were a lot of cases. We had a spike in numbers almost as bad as Delta, but not many people with severe disease. So most of us were puzzled. Is this because Omicron itself is inherently a milder variant? Or is it because people have been widely vaccinated and there's been, widespread natural infection, throughout the population, because of which there is herd immunity? We didn't know the answer to this. We thought probably it's a combination of both. But now what we're seeing in China is that here you have a population with little or no sort of, which has had little exposure to natural infection, may have been vaccinated, but little exposure to natural infection, being infected with Omicron itself. But you can see there's so many cases of severe disease over there. So probably it has less to do with the severity of the variant and more to do with past exposure with natural infection, which is why we are seeing so many people getting sick in China but we are not expecting the same to happen over here. So this is our best guess. COVID has proved us wrong many times in the past, but in all probability, based on the track record of the last 2.5 years, we're not expecting too many cases of severe disease this time. Just a lot of coughs and colds. But having said that, severe disease is not the only thing that we're concerned about when it comes to COVID. There's also the risk of thrombosis. So when we would see COVID patients at the peak of previous waves, we would have a lot of young people with heart attacks, young people with strokes, unexplained thrombosis, in the absence of risk factors. So at this point, it is established scientifically that COVID induces a prothrombotic state, where there is a tendency for clots to form. So that's also one reason why one would want to avoid COVID, even if there is a decreased risk of severe disease. Then, of course, there is the risk of long COVID, where your symptoms sort of persist for weeks to months, and they impair your functional status. You're not able to live your life as freely, not able to work as effectively because these symptoms keep persisting. So apart from thrombosis and long COVID, what we as clinicians are primarily concerned about is severe disease. There is a drop in oxygen saturation, and hopefully that should not happen this time.
Right. Thank you very much, Dr. Desai, for this introductory comment. So let's look at the basics, because we've been discussing COVID after over a gap of a year now, and let's look at the basics. And this is also the season for cold and cough. It's the season when it's the time of the year when we see seasonal changes in cities like Mumbai, for instance, and fair number of other parts of the country. There's metro work which is going on, so there's a lot of construction. The AQI levels are down, etc. So is every common cold to be looked at with suspect? Is the entire sardi khansi that we talk about, should we all be scared when you have somebody next to you who is perhaps sneezed or coughed, etc., which was the case, say, a year and a half back?
So when the prevalence of the disease in the community is high, which means if you are living through a wave, where there are large numbers of cases in the community, at that point, it is reasonable to assume that any fever with cough or upper respiratory symptoms is COVID until proven otherwise. But that is not the situation now, in India at least, and in many parts of the world, because there are many other respiratory viruses that are circulating right now that are actually causing more morbidity than COVID. For example, influenza. It's possible that in many countries, influenza is now again the leading cause of respiratory illness related deaths rather than COVID. In North America, in Canada, for example, a lot of pediatric hospitals are flooded with sick children because of respiratory syncytial virus. So RSV is something that causes upper respiratory infections annually, but it's something we never really test for. It's something that can cause a severe illness in children. These children have remained indoors for 2 years because of lockdowns, etc. And now all of a sudden, this whole cohort is being exposed to RSV. So currently, we are not living in a situation where every infection is COVID. There are multiple other candidates which we don't test for. And unless we actually test, we won't know. So if you do have respiratory symptoms, better that you get yourself tested. And I say this knowing that over the last couple of months, we've stopped. Most people don't test themselves for COVID anymore because at this point, it's not much of a severe disease. But now there is this need to know whether cases are rising in the community or not, right? So
let me ask you a very pointed question. If I have cold and cough, should I be going in for a test in a day or two? If it doesn't subside?
There's no sort of clear answer to this. If you're young, if you don't have comorbidities, if you're not living with people who are elderly, if you don't have elderly parents at home, then it's okay. You can sort of manage yourself symptomatically and be done with it. But if you are elderly, if you have comorbidities, it would be better to get yourself tested so that one can anticipate the occurrence of complications at the end of the first week. No one is going to anticipate hypoxia happening at the end of the first week if they don't know that they have COVID. So if you belong to a high-risk group, better that you get yourself tested.
Doctor, should we bring these back in our lives?
It would probably be prudent to start masking again, definitely. We don't know that a wave is coming in India because these variants that are circulating in China have been circulating in India for the last couple of months. In the sense, these are not new variants, right? It's possible that these variants have entered China from the rest of the world, rather than arising in China and then sort of spilling over here. But in anticipation of a future wave, it would be better to wear masks, especially when going out in public places, where there are a lot of crowds, the metro, the local train, that sort of a thing. And again, this applies more for people who have a higher risk of developing complications on COVID. Again, elderly, comorbidities, and unvaccinated. If there are any out there who are unvaccinated.
Thank you. We have a question from Mr. Malcolm Montero, and which is what even I was going to ask you. How essential is it to take the precautionary dose, that is a booster? If a person has taken the first 2 doses of AstraZeneca, if a booster is to be taken, should I, Mr. Malcolm Montero asked, should he take the AstraZeneca or some other? He's 69 with no comorbidities.
Okay. So most data shows that 2 doses of the vaccine, while it may not prevent reinfection, offers good and lasting protection against severe disease. That protection is enhanced with a 3rd dose, or as the government likes to call it, a precautionary dose. So considering that we don't know how things are going to unfold over the next couple of weeks, it would make sense to take that precautionary dose. Now, if you're looking at taking Covishield again versus a different vaccine, there are multiple studies that show that a heterologous combination, that is your booster dose being a different vaccine as compared to your primary series, offers a much better sort of immune response. So the issue with vaccines like Covishield is, the way Covishield is made is, the COVID spike protein is mounted upon a viral vector. So when you get your first dose of Covishield, your body forms antibodies against the spike protein. It also forms antibodies against the viral vector. So when you take the 2nd dose, again, that viral vector is attacked by your antibodies and the immune response is not as effective. So if you're looking to take a precautionary dose, let it be something else, perhaps a recombinant protein vaccine like Corbevax. So studies are showing that protein subunit vaccines, if taken as a precautionary dose, at least in vitro, offer a much more enhanced immune response as opposed to taking the same type of vaccine that you have taken for your primary series for the booster as well.
Doctor, we have a question from Mr. Brigadier Kalia. Mr. Brigadier Kalia, he is 77. He asks, oximeter readings keep changing and repeated testing at the same time. Are oximeters reliable? Is there any specific standard oximeter recommended?
So whenever one puts a pulse oximeter on one's finger, initially it may start off with a low reading. And then over a couple of seconds, gradually it will rise. Yeah. So the highest reading is the truest reading. A lot of people, what would happen, when they had COVID and they were home isolating and checking their own oxygen saturation, they would snap the probe onto the finger and it would start off with an 89%, let's say, and then they would panic and we would get calls saying, should I come to the hospital? So what we would tell them is just keep it there for a few seconds more, let the reading rise. And more often than not, it will eventually rise to 97, 98%. There are a lot of brands out over there, some more expensive, some cheaper, but more or less they all do their job fine. The other thing is, if your fingers are cold, if you have cold extremities, then it takes a little longer for that signal to be picked up by the pulse oximeter. The third thing is if you're wearing nail polish, that is something that can give falsely low pulse oximeter readings. So just remember to keep the oximeter on the finger for at least 15 to 30 seconds. If it's not showing a proper reading, change fingers, warm your hands, and the highest reading is the truest reading. Don't panic if it starts off with an 85 or an 89%. It will rise.
And I just looked at my oximeter at home, and I find that the battery has gone off. So I think it's also good to check that the battery is in order, etc., etc. So Dr. Brigadier Kalia has asked, have taken all 3 doses of vaccine. Any preventive medicine recommended against corona? He's 77 and a diabetic for the last 12 years.
Right. So there is no medicine that can prevent the infection, in the sense we don't have any pre-exposure prophylaxis available. However, if you do get COVID, and let's say you have mild disease and you are in your first week with the normal oxygen saturation, then there are drugs that can be considered that can reduce the risk of progression to severe disease. That is, drugs that you take in the first week that reduce the chance of you having a drop in oxygen saturation at the end of the first week. So one of those is remdesivir, 3 days of an IV course. The others are fluvoxamine. The third is Paxlovid. The fourth is molnupiravir. But the issue is now all of these drugs were tested in the Delta era or before that, where a very large number of people would progress to severe disease. In the era of Omicron, that number has really, really come down. So as a doctor, I doubt the benefit of anyone taking any kind of specific treatment in the first week of the disease to prevent progression to severe disease. And with regards to preventing infection, there is no drug like that. We don't have anything.
Doctor, should I be beginning to take this Zincovit again? Like a precautionary medicine?
I mean, apart from the general health benefits of multivitamins, it has absolutely no role in COVID. It's neither going to prevent the infection, nor is it going to increase the speed of your recovery, nor is it going to reduce the chance of you progressing to severe disease. I know that multivitamins were part of the standard cocktail that thousands of people got across the country, but there is no evidence base for it.
So there's no need for me to, for me as well as in everybody else to be armed, to be popping in these Zincovits and vitamin C, etc., just as a precautionary measure.
From the point of view of COVID, no evidence to back its efficacy. No point taking it for the sake of COVID. If you, let's say, have a vitamin deficiency or in general you want to be healthy, that sort of thing, that's a different matter entirely. But it's not going to change the outcome with regards to COVID at all.
And what about the various immunity boosters, especially the ones in non-allopathic modes of practice?
So you have a lot of these being sold on the market, but you will find that none of them have any evidence to support their efficacy. In the sense, no clinical trial would have been conducted where one group gets it and the other group doesn't, and then they are followed up, and then we check the incidence of COVID in both groups and see if there's a difference. Their efficacy has not been scientifically studied. So at this point, I would not recommend any of them at all. In fact, I would say that this is mostly unscrupulous people taking advantage of fear and trying to sell their products. So ideally, these products should be held to the same standard that regular allopathic medicines are held up to. There has to be clear-cut evidence of their efficacy before they are approved. But unfortunately, in our country, for some reason, we have differing standards for these things.
The response to that is that while they may not have been clinical trials, but these have been there for generations, for hundreds and thousands of years.
I understand what you're saying, but if you want to approach this from a scientific point of view, until there is clear-cut evidence in an experimental setting to show that it works, no scientific person is going to buy this. Nothing is stopping them from conducting these trials. I don't think we should go by the logic that old is gold. There are a lot of things that society has sort of had for centuries, and they are not good at all. So let's not get into that. Until there's clear-cut scientific evidence, these are just claims. No point wasting our time on money on this.
Thank you. We have a question from Mr. Satish Nagpal. He's age 62, has comorbidities, but he's fully vaccinated. His question is, and I think we had asked this, but again, a pointed question, and it just shows that despite you having clarified it, it is the question that is being asked. He says, if I get a cold or fever, after how many days should I get the COVID test done?
Okay. So when COVID first started, when we talk about the wild type variant, that is, what came from Wuhan, up to Delta, the viral load in your nasopharynx would rise, 48 to 72 hours before your symptoms would begin. And they would peak around the time of the onset of symptoms. And then after that, gradually it would reduce. So a person could test positive even a day or two before he or she were to start developing symptoms. In the era of Omicron, that peak has shifted a little bit. At this point, the peak viral load is maybe 2 to 3 days after the onset of symptoms. Ideally, as soon as you start having symptoms, if they are consistent with COVID, get yourself tested immediately. The longer you wait, the higher the chances of a false negative.
Thank you. Doctor, this is from an anonymous attendee. If 2 doses and 1 booster are taken, then is it necessary to take a second booster?
It's probably not required. So a lot of countries have introduced the concept of a second booster. What most data shows is that taking an additional booster probably reduces your risk of a reinfection, but it does not really add any value in terms of decreasing the risk of severe disease. Yeah. All we care about at this point is whether or not a person who has COVID is going to progress to severe disease. And if someone has taken their primary series followed by 1 booster, in terms of progression to severe disease, that person is well protected. So at this point, we don't see the need for a 4th booster.
But let me ask you a question about this as to how do you approach it, as you are on the front line in the medical profession and you are an infectious disease specialist. So how are you bracing yourself? You would have taken, like all of us, 2 shots of the vaccine plus a booster. Now, what are you looking at doing for yourself and for your colleagues in your hospital? What is it? What do you all do?
So I think in general, we're tightening our general protocols that we used to follow at the time of COVID, such as universal masking, social distancing, etc. These are things that we've all become lax about, myself included, as an IT specialist. So we're trying to sort of reinforce that discipline. But apart from that, nothing special. We're just sort of keeping a close track of whatever data the government releases, whatever the trends are in other countries, so that we can anticipate when things are, if and when things are going to start getting worse. But nothing special, just masking.
Right. Doctor, we have a question from Marjorie Fernandez, who's asked, is the pulse reading related to the oxygen level? My oxygen level seems okay, but my pulse reading varies quite a bit.
So the way the pulse oximeter works is, the capillaries in the nail beds, so they pulsate, right? So the pulse oximeter will shine a laser into it, and then as that gets reflected, it's able to pick up the pulse waveform. So the first thing you'll see when you put the pulse oximeter on your finger is that waveform appearing, right? And once that reading appears, it is able to detect what percentage of hemoglobin is saturated with oxygen. So if your pulse is varying grossly, it may have to do with the fact that the machine is not able to adequately pick up the pulse rate. So sometimes it detects, sometimes it's not able to detect. But I mean, there are conditions where the heart rate can vary. We can only speculate about it. Mostly, it usually has to do with issues with the machine picking up the pulse waveform.
Right. Thank you. We have a question from Katie Dadanji. Doctor, is it safer to take a nasal spray as a booster than a booster shot if we seniors in our 70s have not taken the 3rd jab? Her next bit is that we wanted to go out of Mumbai on a holiday at the end of December or early Jan by air. Is it safe to travel with masks, and what precautions should we take?
So with regards to the nasal vaccine, so theoretically, and at least in the lab, the advantage of the nasal vaccine is that it induces local mucosal immunity, in the sense at the level of the entry point of the virus. And I know that the phase 3 trial has been ongoing for some time. I'm not sure what the status of it's, in the sense whether it's been published or not yet. I know that it was happening at AIIMS when I was there. The government has approved it. In the sense they've given emergency authorization, but I, as an ID physician, have not seen the data myself yet. So, so I can't give you a good answer to that.
But assuming it is okay, assuming it is passed and it is allowed, so should we be keeping it? Should all of us have one in our homes just in case we require it, or is it only or to be administered under medical supervision?
Yeah, so this is a vaccine. You only get it at vaccine centers. So 4 drops per nostril. This isn't something that one can keep at home. Think of it like your regular Covaxin and Covishield. You have to go to a center, get the dose, and then that's the end of it. Probably it may be a better idea to go for boosters where you have a good sort of evidence base, where we know that that it works, where we have phase 3 trials that are published in peer review journals. Go for a Covaxin or a Covishield or a Corbevax. Let's wait for the data to sort of come for the nasal vaccine before making that our primary choice.
Right now, doctor, for the layperson, if you've taken your 2 shots of Covaxin or Covishield or whatever, and the 1 booster, there's nothing else that you can perhaps take, right? Nothing officially allowed.
Nothing officially allowed. There's no 4th dose. There's no 2nd booster as a part of the government recommendations. Again, best thing that can be followed is wear a mask in public. Stick to the basics. I think that is a lot more important than looking at any kind of preventive medicine or any kind of additional booster doses at this point. Anyone who has taken 2 doses plus 1 booster has good protection against severe disease. The variant is going to keep changing, but your propensity to develop severe disease at the end of the first week is something you are well protected against.
And so if a person hasn't taken a booster for whatever reason, because she or he would have had a COVID infection, and after that, things have just phased out in terms of the energy levels to have the Covaxin, to have the precaution dose. So is it the right time to take the precaution, to take the booster shot right now?
If 6 months have passed since the last time you had a natural COVID infection, probably now would be a good time to get the booster, because immunity does wane with time. But this is immunity versus reinfection. Immunity versus severe disease tends to remain stable with time. So, but if 6 months have passed, definitely go ahead and get the booster, because we're not entirely sure what the future holds for us.
Right. This is a question from Rama Sharma Rampali, who's 74. Who says CT value is also an indicator of severity of the disease. Is that right?
So that's actually incorrect. So CT value is just sort of giving an idea of how much of the viral RNA was present in the sample that was collected. So in a PCR test, what is being done is we're trying to find the RNA of the virus, and then we're amplifying it. So this happens in multiple cycles. So the fewer the cycles that are required to amplify it, the higher the viral load. So all the CT value is giving an idea of is a semi-quantitative sort of idea of how much virus there is, but it does not correlate at all with the severity of the disease. It does not correlate with outcomes. It does not correlate with your symptoms. Actually, you should not be looking at the CT value at all. All it does is confuse and create panic.
Right. Thank you. We have a question from Marjorie Fernandez again. It has been answered by various doctors in the past, but since it's been asked, let me raise it. Taking steam was supposed to reduce the risk of getting infected by COVID. Is this true now also? And I know that there were issues of people overdoing the steam bit. So you could perhaps throw the light on that as well.
I'm not sure what answers other doctors have given on this, but there is no evidence to either support or refute this. In the sense, the study has never been done. Steaming is not going to prevent COVID, but if you do have the infection, it might help your symptoms feel a little better while you are naturally recovering from it. It has no preventive benefit at all. So you don't need to obsessively steam out of fear that the COVID is circulating and I may get it. There's no benefit to that.
Right. Doctor, we have a question from Sumer Chand Jain, who's 80. His question is something in general, and which has also been asked by Suresh Khate, who's 70. Mr. Jain's question is there any way to measure our resistance power to be affected for disease and ways to improve? And Mr. Khate's question is, in order to keep high immunity, what precautionary measures elderly persons should take? So one, is, is there a way to measure the resistance power? Should we take that the test for the the antibodies that exist in your body, and the high immunity boosters that exist? Is there something specific that that seniors can do?
So the issue with COVID antibody levels is, again, it does not correlate with immunity at all. All they indicate is past exposure. So you've had people, with high COVID antibody titers who have developed severe disease, and people with no antibodies at all who just had mild disease and recovered by themselves. The presence or absence of antibodies and their specific titer, whether it's high or low, does not correlate at all at this point with whether you're going to have severe disease or whether you are protected against infection in the first place. There is a term that we use, when we discuss vaccines, that is immune correlate of protection. So what we mean by immune correlate of protection is when you are trying to test a vaccine to see if it works. If there were a blood test, which one could do after someone getting vaccinated, which says that the person has developed immunity or not. If such a blood test existed, then that would be the immune correlate of protection. So, for example, with hepatitis B, once someone gets the hepatitis B vaccine, we measure the hepatitis B antibody levels. If the levels are more than 10, that 100% correlates with protection. So with Hep B, you have an immune correlate of protection. With COVID, we still don't have such a thing. There is no blood test, which can reliably say that someone is protected or has good immunity, which is why when these vaccine trials are done, we actually have to follow up thousands of people to see whether or not they develop the disease. Because up until this point, we don't have the immune correlate of protection. So with regards to what one should do to maintain their immunity, nothing specific. Just live a normal, happy, healthy life. Eat your regular ghar ka khana, exercise regularly. There is no specific medication, no specific intervention that one needs to do to sort of boost one's immunity.
Doctor, let me ask you a few questions once again. Travel, yes, no?
I'm going to be cautious in answering this, but I think at this point, don't cancel any plans. Looking at what's happening in China, don't cancel any travel plans from India. What's happening in their country is a completely unique situation. So,
should one go for the New Year's Eve party?
With adequate precautions, with masking. If you belong to a high-risk group, reconsider.
And weddings in the family or of neighbors or whatever?
Again, with precautions as far as that is practically possible. But again, most of us don't expect that things are going to return to the way they were in 2020, 2021. It's just going to be a coffee.
What about public transport, Ubers and Olas? Should one be wearing a mask in them?
To be on the safer side, yes.
Should we also get our domestic help to be wearing a mask?
So, the numbers haven't yet started rising in India. So usually what happens is before a wave, for a week, we will have numbers gradually rising. So at that point, we know that, we're in trouble. That has not started yet. So at this point, I don't want to sort of unnecessarily create panic and say, send your domestic help home or ask him or her to wear a mask or cancel your New Year's Eve parties or your weddings or don't use public transport. We are not at that stage yet. And even if the numbers start rising, it's unlikely to be a flood of severe cases. It's most likely going to be a cough or cold. So again, I say this with caution, but we are not at that place where we need to sort of stop living our lives normally.
And if I haven't taken the influenza vaccine, is it a better idea not to? But is it good to take it now?
Yeah, so the influenza season is normally, from the middle of the monsoons onwards, in our country at least. In the West, it is usually, the winter months, but for us, it is sort of September, October, November, depending on what part of India you live in. So the best time to actually get the influenza vaccine is pre-monsoon. Having said that, if you haven't gotten it now, go ahead and get it. It's an annual vaccine because, the circulating strains of influenza keep changing from year to year. So if you have not got it, definitely go ahead and get it.
Then if I take it now, so if I take it in January, then when is the next time I should be able to take it?
So you will have to wait for the next the next vaccine formulation to come out, and then preferably go for it in, let's say, April, May, June.
And so, which means I can take it in Jan as well as I can take it in June.
Yes. So the formulation changes every year. So at this point, when the next formulation comes, then you don't have to specifically wait for a year. You just take it in the pre-monsoon season and wait for the next year's formulation to sort of become available.
Thank you very much, Dr. Desai, for the session today. We've responded to around 20 questions here, and perhaps more from me. But you have been able to address possibly most of the fears that exist in the minds of people. I know I have a huge number of doubts myself, and because COVID has happened with us, the first phase, the second phase, the third and fourth. Omicron itself had two kind of sub phases. So there is a fear which exists, and in cities like in most of the cities in India, where there's a fair amount of road construction happening, a lot of civil work happening, there's a lot of dust and smoke across the country. AQI levels are rising, and it's a very unhealthy atmosphere out there. So in that sense, it's great that you have allayed most of the fears right now. You have clarified most of the things. Clearly, it's good to be following safe practices, wear a mask, hand hygiene, etc. But there's no reason for fear. And I think on that note, we could end the evening. We are not going to be there next Saturday, which is the 31st, one day off, and we don't want to talk about health issues around that time, but we will be back the Saturday after that, which is January 7th at 5 p.m. for a session. We have Dr. Monica Das, who many of you know, who's a leading psychologist, who's going to be talking about the year ahead and positivity and New Year resolutions, etc., etc. So we have a host of topics lined up for the new year. So see you in the new year. Jan 7th is when we'll be there. We won't have a session 31st at 5 p.m. We are allowed to take a couple of weekdays off. So please indulge us for that. You can, as always, pre-register for our health webinars. The chat window is there here, and you could register, and we will inform you. While the health webinar is off, the Seniors Today website is very much there. So you can visit us every day, seniourstoday.in. The magazine, as you know, we've had 42 issues so far, and you can read up all the issues free of cost on our website, that is seniourstoday.in. You can subscribe to our newsletters, which come to you every morning at 6:30. We are very sure about our time. Just as we start the health webinar every Saturday at 5 p.m., the newsletter comes to you every morning at 6:30 a.m., Monday through Saturday. Thank you very much for being around. Thank you very much for being there with us through the year. And thank you very much, Dr. Desai, for being here. Thank you very much to the folks at Ruby Hall to have facilitated this. And to all of you here, please have a great year. Don't worry too much. Yes, we need to all maintain safety standards, but I know we've been through this entire last 3 years of stress and fear, but I don't think it's going to be that bad. Let's hope the next year is much better. And with wishes for a healthy and happy new year, I'm signing off now, and we will see you again on January 7th. Thank you once again, Dr. Desai, for being here.
Thank you.
Subscribe now and press the bell icon. Never miss an update.